August is a wonderful time of year for a whole range of activities. It's a great time to be outside or maybe take a vacation. And it's a great time to sit back and relax and think about some of the interesting and important aspects of life. In this regard, August is a great time to think a bit about the important work appearing in the American Journal of Psychiatry. Not only is there a long history of impactful science appearing in the journal, but every month brings a new series of important articles. For many years, we've known that there are both strong overlapping features, but also distinct features of neurodevelopmental disorders. Shen and colleagues returned to this idea about shared and specific features in neurodevelopmental disorders in their new study that examines the associations between brain development and features of either Fragile X syndrome or autism spectrum disorders. The unique findings to emerge here is, despite the fact that there are strong clinical parallels between these two conditions, the pattern of brain development is quite distinct in these disorders. So both disorders show patterns of abnormal brain development, different from typically developing children. However, each pattern can be clearly differentiated from the other. And this generates interest in using other measures to try to find the unique features of pathophysiology that characterize specific neurodevelopmental disorders. There's been considerable structural brain imaging work on many conditions, but autism spectrum disorders represent a family of conditions where the literature is particularly rich. Girault and colleagues add to this literature by contrasting the patterns of structural brain perturbations in patients with autism spectrum disorders, and members of their family. And the unique findings to emerge in this new study are to show that both risk for autism spectrum disorders and expressions of autism spectrum disorders can be detected in the patterns of brain structure. And somewhat surprisingly, some of these findings arise in the visual cortex, a region that is often not considered when we think about the correlates of autism spectrum disorder. And not only will this generate interest in understanding the distinctions between risk and expression of aspects of autism, but it will generate new interest in thinking about the role of the visual system in autism spectrum disorders.